that brings us to David Limbrick, MLC. Thanks, David.
Thank you, Chair. Thank you to the Minister and her staff for appearing today in the presentation earlier. Although I always enjoy asking the Minister questions in the chamber, today I'd like to direct my questions to the Chief Health Officer, if that's okay. And I'd like to start with looking at the emergency declaration and the restrictions placed on Victorians through that declaration. I got asked a question last night, and I'll start with a really simple question, because I couldn't answer it. The last emergency declaration ended at midnight last night, is my understanding. Is that correct? And then the new one takes effect midnight tonight. So what are we covered by today?
No, the state of emergency. Yeah, sure.
Yeah, I can certainly help you with that. Yep. So actually 2 sets of directions that were signed by the Deputy CHO last night and released. There was a set of directions that are operative until 11:59 tonight, which continue the existing stay-at-home and restricted activity directions. And then there were a set of directions that gave people notice about what comes into effect from 11:59 tonight.
So it was extended by 1 day last night. Right, okay, I understand.
So Mr. Limbrick, they were rolled over to enable, many organisations to prepare. We didn't want to just give people no notice whatsoever. Yep. The same ones rolled over till 11:59 p.m. tonight, and then the new ones will kick in tomorrow. Okay,
understood. And so it's my understanding that under these directions that restrictions on the liberties of Victorians need to be reasonably necessary to prevent disease transmission, and many of the restrictions to the average person, they would appear to be sensible restrictions. But then there are other restrictions such as, the ones that have been in the media, things like, playing golf and fishing and hunting and these sort of restrictions that to many people, if they're doing them by themselves, they don't really understand how they can reasonably prevent disease transmission. So Professor Sutton, what sort of evidence or scientific evidence is used to come up with these restrictions on these things that to many people may not make a lot of sense?
Thank you, Mr. Limbrick. Essentially, the drive with the restrictions is to try and reduce the likelihood of transmission from one infected individual to others, and to bring that number of 2.5 down to below 1. For one particular activity, there is no mechanism to model. We don't know the likelihood of transmission in a particular activity, even a particular high-risk activity. What we do understand is that there's a cumulative risk by virtue of all of those activities carrying on as usual, and that we need to try and reduce that effective reproduction number down below 1 by bundling a number of restrictions together in order to give us an assurance that for any one infected individual, their likelihood of passing on to even one other person is lower. And so the narrative and the restrictions are really were focused and continue to be focused on essential reasons for leaving home. And so the stay-at-home directions really did bundle in a number of essential reasons to leave home that related to work and education as necessary, care and compassion, emergency requirements and food, but that other non-essential activities should be constrained until we can see the effect of what the restrictions would bring into place. They are impossible to model individually, but we know that we were having a doubling every 3 to 4 days in the early part of March and into late March, and that in effect it's the empirical evidence, the evidence that's shown by our gradually decreasing numbers from late March, early April to now, that is proof positive that those restrictions have done the right thing. We've got another period where we can look at empirical evidence in releasing those restrictions gradually and cautiously, and with the precautionary principle in mind, to see that we are still reducing the likelihood of passing the virus on to below 1 person for every infected individual. The precautionary principle is important. It's part of the Public Health and Wellbeing Act. I'm bound to consider it in decision making, and it states that if a public health risk poses a serious threat, lack of full scientific certainty should not be used as a reason for postponing measures to prevent or control the public health risk. And so I've brought that in mind, and obviously the principle of the primacy of prevention. The prevention of disease, illness, injury, disability or premature death is preferable to remedial measures. So although the bundle of restrictions might be seen as very significant, the consequences of having this pandemic get away from us are really so grave that on the ledger, the restrictions are really seen as proportionate to the potentially catastrophic risk. I did need to consider the Charter of Human Rights and Responsibilities in making those directions as well, and that means that all of those liberties and really important human rights, including freedom of association and freedom of movement, were considered, and that the restrictions were proportionate to that very substantial risk.
Thank you, Professor Sutton, for your answer. And so if we are not, if it's not possible to determine scientifically through modelling which particular activities do and don't present certain risks, how do you make the decision between which activities should be prohibited and which shouldn't? Because the example given to me was, surfing was okay and fishing wasn't, and to most people they would seem to be fairly similar risk profiles. How can you make that decision that surfing's okay and fishing, for example, isn't?
What evidence?
In a sense, these are not easy decisions to make. There is some arbitrariness. That's why you'll see an enormous variety across jurisdictions in Australia. The Northern Territory restricted golf, Tasmania restricted golf to 2 persons per hole. Other states and territories have made different choices. But the effective focus that I had was what is essential for people's physical and mental well-being. What are the really key elements, those essential things that people might leave home for or need to leave home for, and what are some non-essential things that for a period of time, and this will change over the coming weeks or days, can be considered non-essential. And so golf, in my view, some other activities were really recreational and didn't provide exercise. There are other alternatives for people's physical health, walking, running, cycling, that were available to them. And those water-based activities are clearly exercise. You get your heart rate up in doing them, surfing, paddleboarding, and the like. But for some, there is a grey area between recreation and sporting activity. We took a view that there were a number of exercise activities that were clearly available to people, and that some of those more discretionary activities, hunting, fishing and the like, were not exercise and could be deferred for a time. Not ceased forever, obviously, deferred for a time because they were non-essential.
Thank you, Professor Sutton, for your answer. That does clarify it. With regards to the bundling of some of these restrictions, I note that in the federal government's staged plan, which presumably will be having something based on that, one of the things that was bundled was brothels. And in fact, the majority of sex workers in Victoria don't work in brothels, and the activities might have differing risk profiles. Will consideration and clarification be given to that community once we reach these different levels of easing?
Yes, as for all specific industries, all specific settings, we need to give consideration of them over time. And part of the principle of the directions in Victoria was that of collaboration, another one of the key principles in the Public Health and Wellbeing Act. And so we really have taken guidance from National Cabinet decision-making and tried to reflect that as much as possible. At times we've been more precautionary perhaps than some other jurisdictions, but we really have tried to reflect the National Cabinet decision-making in doing as they've recommended for state and territory legislation.
except for education.
And on to another issue. So has there been any cases of community transmission within supermarkets that you're aware of?
Not that I'm aware of. I think it's one of those really difficult circumstances to, again, definitively answer. People will report their close contacts. If we can identify an individual who's positive, we know where that transmission has occurred. And so often we find the obvious close contacts are their friends and family, those who share their household. If they've picked it up and we can't identify a close contact, all we can presume is that they've picked it up somewhere outside of their home or workplace or other areas of prolonged close contact. That might be a supermarket, but equally it might have been on a surface that they've touched on public transport, or someone they passed in the street who happened to be particularly infectious or coughed and sneezed at the wrong time. So it is very difficult to say it's definitely been picked up in a supermarket.
Thank you, Professor Sutton. So one specific issue around a transmission vector that I've made a request to the Health Minister to seek advice on was on the issue of reusable bags at supermarkets. And I actually contacted Dr. Ryan Sinclair from Loma Linda University in California, and he's done research into this issue and has actually written an op-ed on the issue urging jurisdictions to temporarily prohibit them. And in fact, many US jurisdictions have been following that advice. What consideration was given to this particular disease transmission vector in Victoria?
Thank you. I should offer you a correction. I'm aware now of one transmission at Coles Brandon Park, but the details I'll need to look into for you. I suspect it's a workplace transmission, and there was a known close contact through working rather than a surface that you might have been alluding to. The issue of plastic bags really is for the committee that now reports into AHPPC and to National Cabinet, which is an infection control expert group. They have considered evidence around infection prevention and control, and I think the issue you raise is one for them to provide AHPPC with expert advice in relation to it. I would note that no surface really presents a risk to an individual if we can maintain really significant hand hygiene, and if we can overcome the habit of touching our face, as you're doing, as most of us do, every 3 minutes, 20 times an hour. We need to recognise that surfaces then contaminate us and potentially transmit when we touch our noses, touch our mouths, and it's not a packaging or a particular environmental surface in and of itself that will necessarily pose a risk. But it's clear that the virus can survive on all surfaces for a period of time, stainless steel in a cold, low humidity environment for a number of days, but other surfaces for a much shorter period of time. It's unclear whether they can sustain, even if virus is detectable, a high enough level of virus for it to be a risk of causing disease or a transmission risk. But it's an important question you raise, and it's one for the National Infection Control Expert Group.
Thank you, Professor Sutton, for your answer. On to a different topic. In my previous career, I've been involved in management groups that have done pandemic simulations. When was the last planned pandemic simulation in Victoria, and when was it actually conducted?
There have been several over the last 12 months. I can't tell you when the most recent one was, but I've been involved in a number, including at the State Control Centre with Emergency Management Victoria last year. There was another one at Melbourne City Council, and we've done some over the last couple of years in collaboration with the Office of the Chief Veterinary Officer and Department of Environment, Land, Water and Planning around a potential disease that's transmitted from animal to animal initially and then jumps into human pandemic potential. So there have been several just in the last 12 months.
Mr. Limbrick, I think the Secretary might also be able to add some more information for you.
Thank you. I was just going to add that in addition to Professor Sutton's reference to the State Control Centre as a departmental executive, we run regular exercises as well. And we did run an exercise, certainly in the last quarter of last year.
Thank you very much for that clarification. And Professor Sutton, another issue around I'd like to move to is around the COVID-safe application that's been used for contact tracing. It's been put to me by several IT experts that the application on certain devices, such as iPhones, will not actually work unless it's in the foreground and running. So if it's in the background or the phone's locked, it will not actually work correctly. And the measurement of the number of people that actually have access to it, the federal government's been talking about number of downloads. It's my understanding this is not a good metric for measuring whether an application's being used. It should be something like the daily active users. How will you be able to determine whether this application will be able to provide good data for contact tracing?
It's a good question. What I do know is that our contact tracers, our army of disease detectives will continue to form the backbone of follow-up of close contacts and determining where people might have acquired their infection. But I've downloaded the app, the Minister's downloaded the app, the Premier's downloaded the app, and the proof will really be in when we get data that we haven't been able to identify through case interviews. So in a case interview, we would ask all individuals during their relevant period, so when they're infectious and for 48 hours prior to developing symptoms, everyone that they've had more than 15 minutes of face-to-face contact or more than 2 hours in one room. So the app will be able to provide additional information for those circumstances where someone might have forgotten an individual where they've spent more than 15 minutes. And obviously in those circumstances where they might be sitting in close proximity on public transport or in a queue where they might have been within 1.5 metres. And so we will see those circumstances where the app data provides us information that we hadn't already picked up through our contact tracing procedures over the phone in the traditional way. So it's very hard to predict how often that will occur. If there are 5 million downloads to date and the majority of those are active users, then something like 20% of all individuals might have that Bluetooth enabled, but that only means that a few percent of total interactions between individuals will have that Bluetooth handshake. Nonetheless, if that provides an additional measure of close contacts that we wouldn't otherwise have picked up through traditional contact tracing, then that's got to be seen as a useful and positive contribution.
And I believe we're out of time, so thank you very much, Professor Sutton.